Hello, everybody, and welcome. This is Nurse Eunice, and in today's video, we have the best CPR and BLS review and practice test for 2026. And of course, this is based off of the new American Heart Association guidelines. My name is Eunice Mathis. I go by Nurse Eunice. I've been a registered nurse now for 27 years. My background includes telemetry, that's the study of the heart, and also critical care. In addition to being a nurse entrepreneur and a healthcare educator, I'm also an American Heart Association Training Center faculty member for CPR, BLS, ACLS, and PALS, and also the instructor courses. So I am so honored to be your instructor and host today. Why is refreshing CPR knowledge critical? In emergencies, every second counts. Knowing how to perform CPR and use an AED can be the difference between life and death. Whether you're a healthcare professional or a bystander, staying updated with CPR guidelines ensures you're ready to act when someone needs you most. Let's discuss important limitations and disclaimers. Before we begin, please note, if you disagree with or have questions about any content, first, consult your American Heart Association Basic Life Support Provider Manual. And if it doesn't look like the one that's in the image, more than likely you are using an outdated manual. Ensure you are using the most current edition because CPR and BLS guidelines change over time. Older manuals, online videos may contain incorrect information. This review is based on current 2025 AHA Basic Life Support Standards, and most of those videos will be, if your instructor isn't currently using the video, they have until February 28th, 2026 in order to do so. It's also based on evidence-based resuscitation guidelines. Again, when in doubt, the AHA Provider Manual is your final authority. What does CPR mean? CPR is cardiopulmonary resuscitation. Cardio referring to the heart, pulmonary referring to the lungs, resuscitation meaning to revive or to restore life. So whenever you're performing CPR, you're either performing chest compressions, providing rescue breaths, or you could be doing both compressions and breaths in order to maintain blood flow and oxygen delivery to the brain and vital organs and to buy time until advanced care or defibrillation is available. If you're a healthcare provider, I know you're familiar with the acronym ABC. However, whenever we have a victim, a patient who's in cardiac arrest, the correct order is not ABC, it is CAB. Your focus is on compressor crowd arrives. You can focus on airway and breathing. So as a single rescuer, let's talk about those compressions. You're going to push hard and fast in the center of the chest. You're going to minimize interruptions to no more than 10 seconds. Once help arrives, or once you have your barrier device, you can focus on airway. You're going to open the airway using a head tilt chin lift, and you're going to provide those rescue breaths. As a key reminder, when someone is in cardiac arrest, meaning that they do not have a pulse and they are not breathing, compressions always come first. The AED is the automated external defibrillator. It is the device that we use in order to analyze the heart's rhythm. It also delivers a shock only if indicated, and you use it as soon as it becomes available. So when you do your pulse check and you're checking for breathing and you realize the victim does not have a pulse and they are not breathing, you're going to go ahead, and if you haven't called out for help, you're going to do so. But then specifically, you're going to ask someone to bring you the AED as you begin your chest compressions. ROSC is another term that you're going to hear when you take your BLS course or Basic Life Support course. ROSC refers to the return of spontaneous circulation. That is when the heart starts beating effectively again. How would you know if it was beaten effectively? Because you would be able to palpate or feel a pulse. Remember, whenever you're taking a pulse, you don't do so with your thumb because your thumb has its own pulse. You use 2 or 3 fingers, preferably your pointy and your middle finger, and maybe your ring finger. You would also have an indication that your patient may have achieved loss because the patient starts showing signs of life, such as they start breathing, maybe their eyes are flickering, they're moving more. And if you're taking the blood pressure, maybe those numbers are starting to increase. So now you're actually getting the blood pressure reading. What is closed loop communication? It is a clear communication method used during emergencies. It helps to prevent errors and confusion. How does it work? Whenever a task is assigned by the team lead, the receiver repeats the task back. And then they would also let the team lead know whenever that task has been, I'm going to be starting the IV. And then you would also let them know once you've gained access. Compression to breath ratios for one rescuer. One rescuer CPR, regardless of the age of the victim, your compression to breath ratio is going to be 30 compressions followed by 2 breaths. And the way that we say that is 30 to 2. Again, that applies to all ages. So your instructor during your American Heart Association Basic Life Support course may discuss with you how if a patient is intubated or if they have a tracheostomy, aka we are just focusing on the basics. For all ages, the compression rate is 100 up to 120 beats per minute. So that's how fast you have to be compressing on the chest. Now let's discuss the compression to breath ratio for 2 rescuers. Whenever you have 2 or more rescuers for a child or an infant, your new ratio is 15 compressions to 2 breaths. So for example, you are the one who finds the child who is unresponsive. They don't have a pulse. You've called for help. You've called for the AED. You begin your chest compressions. And because you're a single rescuer, it's going to be 30 compressions followed by 2 breaths. But whenever that person returns and they get into position, now there are 2 rescuers. Your new ratio would be 15 to 2. Why? Why do we change when we have more rescuers for a child or an infant? Because we have to give more breaths. Children and infants are more likely to experience respiratory causes of arrest, and they breathe faster than adults. So within the same time frame of 2 minutes, you're normally giving about 20 to 30 breaths per minute when you switch to 15 to 2 for a child or an infant. So you would be given the same number of compressions, but more breaths. Next, let's discuss critical cardiac rhythms to know. As a basic life support provider, we are not expecting for you to be able to read cardiac monitors. However, whenever you call for that AED, the defibrillator, it's going to actually detect whether a patient's in asystole or ventricular fibrillation. So let's discuss the differences now. Asystole is a flat line. So when you look at the monitor, you're going to see a line without any quivers. It's just really flat. That indicates no electrical activity. It's not a shockable rhythm, and it requires high quality CPR, the BLS, those chest compressions and breaths. And whenever the rapid response team arrives, it's also going to require those advanced medications, such as the ACLS medications. Meanwhile, ventricular fibrillation, or VFib, is chaotic and disorganized electrical activity. Because the heart is just quivering, it does not produce any effective cardiac output. That would be a shockable rhythm that the AED would detect. And so whenever a patient has VFib, we defib, we defibrillate. So VFib requires early defibrillation plus CPR. Final reminder before the practice test. Whenever you're performing CPR, You focus on high quality CPR. That means compressing deep, compressing fast. Remember, we're compressing at least 100 to 120 beats per minute. And then as far as your depth, it is going to be 2 to 2.4 inches for adults, 2 inches for children, and 1.5 inches for infants. You also have to know your ratios and terminology. If you're a single rescuer, for all ages, it's 30 compressions to 2 breaths. For children and infants, if there are 2 or more rescuers, it's going to be 15 to 2. Use the current American Heart Association standards and then read questions carefully. Testing language matters. So the terms that we used, ROSC, AED, familiarize yourself with those because you're going to see those again in your actual class. Remember, you're not just memorizing information. You're preparing to save lives. At Florida Training Academy, we have been providing provider and instructor level courses for over a decade. If you'd like more information, you can go to our website, which is fltraining.com, or you can scan the QR code that is on the screen. Let's start with our practice questions. Question number 1. According to the 2025 AHA guidelines, what is the recommended sequence for relieving severe foreign body airway obstruction or choking in a responsive adult? Is it A, abdominal thrust only until the object is expelled? B, 5 back blows followed by 5 abdominal thrust? C, chest thrust only? Or D, blind finger sweep followed by rescue breaths? Revealing the answer in 3, 2, and 1. According to the newest guidelines, the answer is B, 5 back blows followed by 5 abdominal thrust. The 2025 AHA guidelines now recommend a cycle of 5 back blows followed by 5 abdominal thrust for adults and children, aligning with the ILCOR recommendations to increase effectiveness. And here's an illustration. You want to support the choking victim. You're going to hit them in the back 5 times. 1, 2, 3, 4, 5. And then lower your hands. You're going to be about an inch above their belly button, and you're going to give 5 abdominal thrusts. You're going to do upward and inward thrust. And you continue that until the object is expelled or until the person becomes unresponsive. If they become unresponsive, you would lower them to the floor. Of course, you're calling for help. You would begin CPR, which begins with chest compressions. Question 2. You are performing high quality CPR on an adult victim. What is the correct compression rate? Is it A, 100 to 120 compressions per minute? B, 80 to 100 compressions per minute? C, 120 to 140 compressions per minute? Or D, as fast as possible? And this practice test has 50 questions, so you're going to be overly prepared for your basic life support examination. If you chose A, you're absolutely correct. The recommended compression rate for victims of all ages is 100 to 120 beats per minute to maximize cardiac output. Question 3, what is the correct compression depth for an adult victim? Is it A, approximately 3 inches, B, at least 1 inch, C, 1/3 the depth of the chest, or D, at least 2 inches, 5 centimeters, but no more than 2.4 inches, which is 6 centimeters? All right, and for this one, if you gave me one of 2 answers, I will take them. So I will accept C and D. All right, so for this one, I have D, but you can compress the chest 1/3 the depth. Here's the rationale for D, at least 2 inches, but no more than 2.4 inches. Compression depth must be deep enough to generate blood flow, but not so deep that it cause injury. So the standard is at least 2 inches or 5 centimeters. Question 4, when using an AED on a victim with a hairy chest, the pads fail to stick. What is the best immediate action? A, press down firmly on the pads and hold them during the shock. B, place the pads over the victim's clothes. C, use the razor in the AED kit to quickly shave the area. Or D, move the pads to the stomach. All right, revealing the answer in 3, 2, and yes, it is C. Great job. You're going to use the razor in the AED kit to quickly shave the area. Good contact is essential for analysis and shock delivery. Shaving the placement area ensures the pads adhere to the skin. And if it's taking you too long, you don't have a razor in your AED kit, continue chest compressions. When in doubt, go back to your chest compressions. Question 5. You find an unresponsive victim with no pulse and no breathing. After activating the emergency response system, what is your next action? Is it A, start chest compressions immediately, B, give 2 rescue breaths, C, check for a pulse again, or D, apply oxygen? Great job, team. You have the correct answer. Yes. When the victim has no pulse and no breathing, and you've already called 911 or you've activated that code button to get rapid response in the room, you're going to do A. You are starting chest compressions immediately. The CAB, compressions airway breathing sequence, prioritizes early compressions to circulate oxygenated blood. Question 6. What is the compression to ventilation ratio for a single rescuer performing CPR on a 5-year-old child? Is it A, 15-2, B, 10-1, C, continuous compressions without breaths, or D, 30-2? You have it. That is correct. The answer is D, 30-2. For a single rescuer, the ratio is always 30-2, regardless of the victim's age. That is, unless the victim has an advanced airway. And during your BLS class, your instructor will tell you about that. Question 7. Which of the following describes the correct hand placement for infant CPR, one rescuer? Is it A, 2 hands on the center of the chest? B, 2 fingers in the center of the chest just below the nipple line? C, 1 hand on the upper chest? Or D, 2 thumbs encircling the chest? I know this one's tricky because the AHA just changed the guidelines. So for this one, the answer is not B. The answer is D, 2 thumbs encircling the chest. According to the 2025 updates, the 2-finger technique has been eliminated because research showed it often fails to achieve adequate compression depth. While the heel of 1 hand technique is a valid alternative if you cannot physically encircle the infant, think of somebody who has arthritis. The hand placement must be on the center of the chest, not the upper half of the chest. And so 2-thumb encircling hand technique is the new way that you perform, whether it's single rescuer or 2 rescuer CPR. And here is an example. Question 8. When performing 2 rescuer CPR on an infant, what is the recommended compression to ventilation ratio? I know, how scary. Is it A, 30-2, B, 5-1, C, 15-2, or D, 50-2? That's right. I can't trick you. We've covered it. And yes, you have the correct answer. It is C, 15-2. When a single Rescuer is available for children and infants. The ratio changes to 15:2 to provide more frequent ventilation. Great job, team. Question 9. How often should rescuers switch roles during CPR to prevent fatigue? Is it A, every 5 minutes? B, only when the compressor says they are tired? C, after every shock delivered by the AED? Or D, every 2 minutes or after 5 cycles of 30:2? I know this one's tricky. This one's tricky. But yes, you have it. It is D. Every 2 minutes or after 5 cycles of 30:2. If you only switch after an AED delivers a shock, what if the person's in a systole and the AED never indicates that a shock is required? So that's why C is not the correct response. The correct response is D. Switching every 2 minutes ensures compressions remain high quality and the compressor does not become exhausted. Question 10. What is the maximum amount of time you should take to check for a pulse? Is it A, 5 seconds, B, 10 seconds, C, 30 seconds, or D, 15 seconds? Perfect. Yes, it is 10 seconds. So the answer is B. Pulse checks should be at least 10 seconds, but no more than, should be at least 5 seconds, but no more than 10 seconds to minimize interruptions in CPR. So for those people who are on the rapid response team, those advanced rescuers, they can do a quick pulse check, 5 seconds, get back on the chest. But in your classes, we allow you up to 10 seconds because, again, this is basic life support. We have to give you an opportunity to learn what you're doing and to grow in your clinical and your critical thinking abilities. Question 11. In the 2025 guidelines, where does the administration of naloxone fit into the BLS sequence for a suspected opioid overdose? So, in other words, when do we administer Narcan? Is it A, give naloxone before starting CPR? B, wait until EMS arrives to give naloxone? C, give naloxone as soon as it is available, but do not delay high quality CPR? Or D, do not give naloxone if the patient has no pulse? You have it. It is C. Give naloxone as soon as it is available. Do not delay high quality CPR. Naloxone is crucial for opioid reversal, but it should not delay the start or continuation of chest compressions. Question 12. You witness a 9-year-old child collapse suddenly. You are alone. What is your first action? A, perform 2 minutes of CPR, then call 911. B, give 2 rescue breaths immediately. C, check for a pulse for 30 seconds. D, leave the child to activate the emergency response system and get an AED. The correct response is D. Leave the child to activate the emergency response system and to get an AED. For a witnessed sudden collapse, the cause is likely cardiac. Immediate defibrillation is the priority, so you should activate the system and get the AED first. Thirteen, which pulse site do you check for an infant? Is it A, carotid, B, brachial, C, radial, or D, femoral? And we'll give you about 3 seconds to enter your answers in the chat. The pulse site for an infant is going to be the brachial pulse, which is located on the inside of the upper arm and is the standard check site for infants. Remember that infants, their heads are larger than their necks, so it's going to be really hard for you to palpate a carotid pulse on an infant. Thus, we check the brachial pulse instead. 14. What is the primary purpose of allowing complete chest recoil between compressions? A, to allow the heart to refill with blood. B, to reduce rib fractures. C, to verify the patient is breathing. D, to rest the rescuer's hands. If you selected A, you are absolutely correct. Incomplete recoil prevents the heart chambers from refilling. So that means always having your hand on the chest. What you're going to hear us say in your BLS class is that you're going to hover. So you're going to raise your hands off the chest whenever it's time for rescuer number 2 to administer their breaths. So let me repeat that rationale. Incomplete recoil prevents the heart's chambers from refilling, significantly reducing the blood ejected during the next compression. So you press down, you allow the chest to fully recoil to rise back up. And then also whenever rescuer number 2 is giving breaths, you take your hands off the chest altogether. Question 15. You are providing rescue breathing for an adult with a pulse. What is the correct rate? Is it A, 1 breath every 3 seconds, B, 1 breath every 10 seconds, C, 1 breath every 6 seconds, or D, 2 breaths every 5 seconds? All right, let's think this through. We have an adult patient who's experiencing anaphylaxis. Their airway has closed. They have stopped breathing. We're trying our best to give them breaths using a back mask device. How frequently do we give a breath? I know this one's tricky. So the answer is C. The guideline recommends 1 breath every 6 seconds, so approximately 10 breaths per minute for adults in respiratory arrest. Okay. And so if a patient is intubated or if they have an advanced airway and they're an adult, it's the same exact frequency. You give 1 breath every 6 seconds. It's no longer a ratio of 5 to 6 seconds. 16. When performing CPR on a pregnant woman, what modification is recommended if possible? A, perform compressions on the back. B, stop compressions and focus on ventilation. C, manually displace the uterus to the patient's left side. D, use abdominal thrust instead of chest compressions. This would be so scary to have to, but according to the American Heart Association, if possible, you would do C. You would manually displace the uterus, mom's stomach, to the left side. So left lateral uterine displacement relieves pressure on the inferior vena cava, thus improving blood return to the heart during CPR. If you are not an advanced provider, if you're not someone who has been trained to do so, you focus on those high quality chest compressions. And when the paramedics, when the ambulance comes, when the rapid response team comes, they are the ones who can displace the abdomen. So if you're afraid to do so, if you don't have enough rescuers, remember, chest compressions are more important if you're a single rescuer than you trying to manually displace the uterus. Question 17. An AED advises no shock advised. What is your next immediate step? A, check for a pulse. B, wait for the AED to reanalyze. C, give 2 rescue breaths. Or D, resume chest compressions immediately. And AED advises no shock advised. What do? You're going to do D. You're going to resume those chest compressions because the AED has already analyzed the heart, which is why it said no shock was advised. You don't have to go back and do a pulse check after the AED has done its analysis. Say no shock advised. If no shock is advised, the rhythm is likely asystole. Remember that flat line that cannot be treated with energy? Or it is PEA, which is pulseless electrical activity. That means that the heart still has electrical activity, but maybe there's something else going wrong, such as the patient has fluid built up around their heart, or maybe they are a victim of some type of traumatic event where there was substantial blood loss. And while the heart is pumping, there's nothing flowing through the heart because they've lost so much blood. And say no shock advised is because maybe this person has a perfusing rhythm. Remember, you're basic life support. You are not advanced life support. So a perfusing rhythm could mean that this patient who was previously in ventricular fibrillation now has a heart rate of 20. You all, that's not enough to sustain life. So whenever the AED says no shock advised, you put your hands back on that chest and you keep compressing until you see obvious signs of life. Remember, you're just the first link in the chain of survival. When those other rescuers come, they have more medications, they have more training, and they can actually stop the efforts, put leads on, and see what rhythm your patient's in. You can't do all that as a BLS provider. Okay? So that was a lot to say, but you must resume CPR immediately to fusion. So keep your hands on the chest until someone with more experience tells you to stop. 18. What is the correct depth of chest compressions for a child? Is it A, at least 2.5 inches? B, at least 1/3 the AP, which stands for anterior posterior diameter of the chest, which is about 2 inches or 5 centimeters? Would it be C, approximately 1.5 inches or 4 centimeters? Or D, only 1 inch? And if you're enjoying this practice test and you haven't liked the video or subscribed to our channels, please go ahead and do so. We appreciate you. Adult CPR and child CPR have many similarities. And one of the similarities is going to be the depth. So the answer is B. Yes, it's still 1/3 or about 2 inches. So that is the correct standard for or older. And what we like to say for the ranges for a child would be age to a stage. It would be from 1 to puberty. And puberty would be signs of adulthood, such as breast development, or if you have a very large child who is an adult weight and adult height, you're going to go ahead and treat them like an adult regardless. Question 19. For an unresponsive infant with a severe airway obstruction, what is the correct action? A, blind finger sweep. B, 5 back blows and 5 chest thrust. C, abdominal thrust. Or D, start CPR immediately. We have an unresponsive infant with a severe airway obstruction. They choked. Here's your hint so you can rethink your answer. Anytime a choking victim becomes unresponsive, we are always going to do D, whether it's an adult, child, or an infant. If a choking victim becomes unresponsive, we're starting CPR. You can check the airway to see if you can see the object that's in their airway before you give a breath. And if you can see the object, you can remove it by doing a finger sweep. We are not supposed to do blind finger sweeps. So if you can see it, you can remove it. 20. Where should AED pads be placed on a child if the pads risk touching each other? A, side by side on the chest. B, on the stomach and leg. C, anterior, posterior, front and back. Or D, do not use the AED. Revealing the correct response in 3, 2, and the answer is C, yes. So placing one pad on the center of the chest and one pad on the center of the back ensures the current passes through the heart without the pads touching. And here's the illustration. So center front and center back. Question 21. You are a lone rescuer or a single rescuer finding an unresponsive infant who is not breathing. The collapse was not witnessed. What should you do? A, call 911 immediately. B, find an AED first. C, perform 2 minutes of CPR and then call 911. Or D, wait for help. Right. Revealing the correct response in 3, 2, and yes, it is C. So whenever you have an unwitnessed arrest of a child, you perform 2 minutes of high quality CPR first to get blood flowing to the brain. So the care first principle applies here. Oxygenate the blood before leaving to call for help. If it's unwitnessed and it's a child, 2 minutes of CPR first, a child or an infant. 2 minutes of CPR first, and then go call 911. And that's assuming you don't have anyone there to call 911 for you, or that you don't have your cell phone readily available where you can just dial and put 911 on speakerphone. Question 22. What is the correct hand placement for abdominal thrust, previously referred to as the Heimlich maneuver, on an adult? Is it A, mid-abdomen, just above the navel? B, on the sternum? C, below the navel? Or D, on the rib cage? Yes, everyone answered it correctly. It is A, mid-abdomen, just above the navel. And so the rationale, the fist is placed against the abdomen in the middle, slightly above the navel, and well below the breastbone. And you would do those upward thrusts. If you don't have anyone to assist you and you're choking and you're by yourself, you can put your abdomen against a chair, something that's sturdy enough to support your weight, like a table or even the edge of a sofa. And you would thrust your body into that object to help relieve or remove your own obstruction. Question 23. When performing back mask ventilation, how do you determine if the ventilation is effective? A, the stomach rises visibly. B, you hear air escaping. C, the oxygen saturation reads 100%. Or D, visible chest rise. You are such a wonderful caregiver. Yes, the answer is D. Seeing the chest rise with each breath is the primary confirmation for effective tidal volume. And that's about half the squeeze of the of the back mask device. So half squeeze should result in visible chest rise. If you see the stomach rise and fall, that means that you are given too much breath. And as a result, your patient could vomit. 24. Which of the following team roles is responsible for recording the time of interventions and medication administration? Is it A, team leader, B, timer recorder, C, compressor, or D, airway? The correct response is B, the timer/recorder. And so this designated role tracks time intervals such as switches and also what medications are administered, and it records events such as when the shocks are administered. 25. What is the maximum interruption time allowed for chest compressions during things like pulse checks or AED analysis? Is it A, 30 seconds, B, 5 seconds, C, 10 seconds, or D, 1 minute? If you chose C, you're absolutely correct. The goal is to keep the chest compression fraction or CCF high, which means that interruption should be limited to less than 10 seconds. Question 26. What is the correct rescue breathing rate for a child or infant with a pulse? Is it A, 1 breath every 6 seconds, B, 1 breath every 10 seconds, C, continuous breaths, or D, 1 breath every 2 to 3 seconds? All right, I see a lot of answers in the chat. If you selected D, you are correct. You're going to give 1 breath every 2 to 3 seconds because children have faster metabolic rates and require 20 to 30 breaths per minute. And the way I like to think of it is who breathes the fastest? An infant breathes the fastest. So for an infant, if you are allowed to, based upon your protocol in your hospital, it would be 1 breath every 2 seconds. But let's say you have a school ager, you have a child who's a little bit older. Well, that would be the person you give a breath 1 every 3 seconds. But follow your medical director's guidelines. Question 27. You are using a bag mask device. Which technique is recommended for holding the mask in place as a single rescuer? Is it A, 2-hand palm technique? B, C-clamp technique, also referred to as EC clamp? C, O-clamp or O-grip? And then D, press down hard on the nose. What is the correct technique when you are holding the bag mask device, the mask portion in place? That is right. It is B, the EC clamp technique. The thumb and index finger form a C on the mask, and the remaining fingers form an E on the jaw. Question 28. If a victim has a pacemaker, a visible lump with a scar on the chest, where should you place the AED pads? A, directly over the pacemaker. B, only on the back. C, do not use the AED. Or D, at least 1 inch away from the pacemaker. If you chose D, you're absolutely correct. You're going to avoid placing pads directly over the device. You're going to remove the pad slightly to one side of the device or below it. Question 29. Why is hyperventilation, giving too many breaths, harmful during CPR? A, it increases intrathoracic pressure, thus decreasing venous return to the heart. B, it increases oxygen too much. C, it causes the lungs to burst. Or D, it wakes the patient up. Why do we want to avoid hyperventilation? That's right, it is A. High pressure in the chest collapses the veins, returning blood to the heart, thus reducing the effectiveness of compressions. So too much of a good thing becomes a bad thing. 30. What is the first step in using an AED? Is it A, applying the pads, B, plugging the connector, C, power on the AED, or D, shout clear? No, it's not D, everybody. It is C. You're going to power on the AED. And some of them, as soon as you open up the case, it automatically starts talking to you. So you have to know how to use the AED at your location. It's usually as simple as 1, 2, 3. And they are so user friendly until if it does have an on button, it's green, which means go. So it's time to go. We have to save this patient's life. So turning on the AED activates the voice prompts that guide you through the rest. 31, in a team setting, what should you do if you notice the compressor is not allowing full chest recoil? A, wait until the next switch to tell them. B, push them out of the way. C, constructively correct them immediately. D, ignore it. Your team members not performing CPR correctly, they're not allowing full chest recoil. What do you do? That's right. We're going to continue working together as a team. You're not going to push them out the way. That's rude. It's going to be C. Effective team dynamics require constructive intervention to ensure high quality CPR. And the American Heart Association has a role that is referred to as the CPR coach. And the CPR coach would be the person who is monitoring the quality of the CPR. And if you don't have that person, it is expected that during CPR, that someone is going to be monitoring the quality so that we can make sure that we are doing our best efforts to save this patient's life. 32, what is the correct depth of compressions for an infant? Is it A, 2 inches, B, 0.5 inches, C, until you feel resistance, or D, approximately 1.5 inches? Revealing the correct response in 3, 2, and it is D. 1.5 inches or approximately 1/3 the chest depth is the specific depth for infants. 33. You are performing CPR on a victim who has been submerged in water. What should you do before applying AED pads? A, remove the victim's wet clothes completely. B, dry the victim's chest. C, no special attention is needed. D, wait for the victim to dry naturally. The answer is B, dry the victim's chest. And so the American Heart Association, according to their 2025 guidelines update, they have recognized that due to cultural differences, some rescuers may feel uncomfortable touching a woman's chest, exposing a woman's chest, etc. And so what that means is that research has indicated that women are less likely to survive cardiac arrest events that happen outside of a hospital because of the chest factor. Male rescuers, if you feel uncomfortable touching the chest, exposing the chest, keep doing those high quality chest compressions. If there's a woman nearby or someone who feels comfortable exposing the chest and drawing the chest, please allow them to take over and do so. So American Heart Association has their guidelines, but as a basic life support provider, my expectation of you is that you're going to do everything to save that woman's life. Of course, you have 911 on the phone. They're going to ask if you have an AED, and if you have one, use it, because women are more likely to die from sudden cardiac arrest if it happens outside of a hospital because of the breast factor. Okay, so let's get over that. We want you to do everything to save a woman's life the same way you'd save a man's life. Question 34. According to the 2025 guidelines, how should you position your hands for adult chest compressions? A, 2 hands centered on the upper half of the sternum. B, on the left side of the chest. C, over the xiphoid process. D, 2 hands centered on the lower half of the sternum. And we're going all the way to question 50. The answer is D. So we're going to avoid the upper half of the sternum. It's going to be the lower half. This position places the force directly over the ventricles or the bottom part of the heart for maximum cardiac output. 35. A victim becomes unresponsive while you are performing abdominal thrust for choking. What is your first action? A, check for a pulse. B, continue abdominal thrust. C, begin chest compressions. D, open the airway and look for the object. The answer is C. If a choking victim goes unconscious, lower them to the ground and start CPR immediately. Do not check for a pulse. Question 36. When should you deliver a shock from the AED? A, immediately upon arrival. B, if the victim has no pulse, regardless of AED prompt. C, only when the AED prompts shock advised. D, after 5 cycles of CPR, regardless of analysis. That is right. It is C. You cannot deliver a shock unless the machine, the AED, identifies a shockable rhythm, such as VFib, which would be VF, or pulseless VTAC, and charges. So the shock would not be automatic. It will let you know that a shock is advised. It'll let you know that it's charging. And then you as the rescuer would have to press the button that delivers the charge. And of course, before you press that button, the word that you're going to shout out would be clear. Make sure that no one is touching the victim, including yourself, because that way it keeps everyone safe and it prevents someone who has a normal perfusing pulse from getting shocked and their heart now changing into a non-perfusing rhythm. 37. Which cardiac arrest rhythm is non-shockable? Is it A, asystole, B, ventricular fibrillation, C, ventricular tachycardia pulseless, or D, atrial fibrillation? And I know those are some big terms, but I already told you this answer, so I know you're going to get it right. Which cardiac arrest rhythm is non-shockable? That's right, the flat line. Okay, D is not a cardiac arrest rhythm. D, atrial fibrillation would be a perfusing rhythm. So we're not going to shock a perfusing rhythm unless it's like super fast or super slow. So for this one, the correct response is going to be A. Asystole or flat line represents no electrical activity. Shock and it does nothing. CPR is the treatment. 38. How do you perform chest thrust on a responsive infant with a severe airway obstruction? A, with the heel of one hand in the center of the chest. B, using both thumbs. C, you should use abdominal thrust instead. D, with 2 fingers just below the nipple line. And this one reflects the 2025 American Heart Association Guidelines update. The answer is not D. The answer is A, with the heel of one hand in the center of the chest. Remember, we're not using the 2 fingers anymore on infants. Infants with severe foreign body airway obstruction, you'll do repeated cycles of 5 back blows. So back blows first, and then alternate with 5 chest thrusts. We don't perform abdominal thrust, and we're no longer using the 2-finger technique on infants because it was not deemed to be effective. 39. What is the best way to open the airway of a victim with no suspected neck injury? A is jaw thrust. B is head tilt only. C is chin lift only. D is head tilt followed by chin lift. Yes, the answer is D. This maneuvers the tongue away from the back of the throat. Question 40. In a 2 rescuer CPR, what is the role of the second rescuer while the first is doing compressions? A, check the pulse continually. B, maintain the airway and provide ventilations. C, rest. D, monitor the feet. If you selected B, you're absolutely correct. The second rescuer manages the head/airway and delivers breaths during the pauses. Question 41. Which of the following indicates a victim has a severe airway obstruction? A, they can speak and cough forcefully. B, they are wheezing loudly. C, they cannot speak, breathe, or cough effectively. D, they are crying. And we'll give you about 3 seconds to enter your responses in the chat. And you have it. It is C. So silent cough, inability to speak, and cyanosis or turning blue are signs of severe obstruction requiring immediate intervention. 42. When checking for breathing, what are you looking for? A, pulse rate, B, eye movement, C, chest rise and fall, or D, skin color? Yes, when you're checking for breathing, you are looking for C, chest rise and fall. You're going to scan the chest for 5 to 10 seconds. 43. What is an agonal breath? Is it A, infrequent gasping breaths, B, rapid deep breathing, C, whistling sounds, or D, normal sleep breathing? I see we're torn with our responses in the chat. So agonal breathing would be A. Agonal gasps are a sign of cardiac arrest and should not be confused with normal breathing. You're going to start CPR. So you go in, you tap and you shout, you're tapping on your patient's or your resident's shoulders. There's no response. Immediately call for help. Press the code button, scream for the nurse. And now for the next 10 seconds, 5 if you're a more experienced healthcare worker, but 10 if you're a little novice or new. You're going to put 2 fingers on the carotid pulse on the side nearest you. You're going to be feeling for the pulse while simultaneously watching for chest rise and fall. You do not feel a pulse, but your patient lets out a gasp. No more breaths, no other signs of life. That is a precursor of cardiac arrest. You scream for that AED and you start doing your compressions. So again, agonal gasp or agonal breathing, person letting out their last bit of air, that would be a sign of cardiac arrest, and you should not confuse that with normal breathing. Remember, there was no signs of life and you did not feel a pulse. 44, for a child victim, if you do not have pediatric AED pads, what should you do? A, do not use the AED. B, cut the adult pads in half. C, perform only breaths. Or D, use adult pads. Yeah, this one's tricky. I agree. But it's not tricky for you all. We're going to use the adult pads. The answer is D. The rationale is better to use adult pads, which will deliver a higher shock than no shock at all. And whenever we are, thinking that those pads are going to touch, we don't use the pad placement that's on the pads. Instead, we're going to put one pad in the center front of the chest and then one pad in the center of the back, as illustrated in the image there. And that prevents the pads from touching. You can use an adult AED on all ages, adults, children, and infants. However, you cannot use a pediatric AED or the pediatric pads on an adult. If you don't have adult pads or if you don't have the AED, remember what we're going to keep doing. We're going to keep focusing on CAB. We're going back to those compressions and focusing on circulation. 45. Closed loop communication involves A, shouting orders loudly, B, repeating the order back to the team leader, C, using hand signals, or D, only the lead speaking or only the leader speaking. Closed loop communication. Yep, you got it. We're going to repeat those orders back. Now look at this team, and it's a rescue team, and they're trying to save a life. And now it could be really loud. It can be chaotic. There could be 10 people in the room. I need to know you're speaking to me. So you're going to point to me. If you can't see my badge because maybe I have on PPE, you're going to point to me and you're going to say, hey, you, because you may not know my name, you are going to do the first round of compressions. And I'm going to repeat it back to you. I have the first round of compressions. So the receiver repeats the order to confirm it was heard and understood correctly. That is how we close the communication loop. 46. Which link in the chain of survival is the most critical for survival from ventricular fibrillation? Is it A, advanced life support, B, post-cardiac arrest care, C, rapid defibrillation, or D, recovery? And I know we discussed a lot, but I told you this in our review section. What do we do for VFib? I see you changing your answers. Yes, for VFib, we defib. So the answer is C, rapid defibrillation. Defibrillation is the only effective treatment for ventricular fibrillation. Time to shock is the biggest predictor of survival. So we need to get that AED on the scene and on that patient as quickly as possible. 47. How deep should chest compressions be for an adult? You know this. We've already talked about it. Is it A, B, C, or D? I know I put centimeters first. And yes, if you chose B, you are right. At least 5 centimeters or 2 inches up to 2.4 inches. That is the standard adult depth for chest compressions. 48. What is the ratio of back blows to abdominal thrust in the 2025 adult choking protocol? Is it 3-1, 5-5, 15-2, or no back blows, only thrust? So A, B, C, or D? That's right. It is B, 5-5. 5 back blows followed by 5 abdominal thrust. 49. You're responding to a pregnant woman in cardiac arrest. An AED becomes available. What is the correct course of action regarding the use of the AED? A, do not use the AED as the shock will harm the fetus. B, wait for the advanced life support ALS team to arrive before defibrillating. C, use the AED but reduce the energy dose by half. D, use the AED immediately and follow standard steps. The answer to 49 will be revealed in 3, 2, and the answer is D. Use the AED immediately and follow the steps of the AED. Here's a rationale. The best way to save the baby is to save the mother. Defibrillation is safe and effective in pregnancy. The best hope for fetal survival is maternal survival. Use the AED as you would for any adult cardiac arrest victim. 50. If you are too tired to continue high-quality CPR and no one else is available, what happens? A, stop immediately. B, continue at a slower rate. C, the AED will take over compressions. Or D, the patient's chance of survival drops significantly. You're getting tired. You're by yourself. No one has come yet. What's going to happen? You all, the answer is D. The chance of survival is going to drop significantly. This is the reality. You're going to get tired, okay? You're going to become fatigued. That is why as soon as you find someone who's unresponsive, somebody who doesn't have a pulse, they're not breathing, you're calling for help immediately. The person who comes to assist you, let's say you're in a home care setting, the person who assists you doesn't have to be certified in CPR. It would be nice if they were, but they can open the door, they can, call 911. If they're strong enough, they could even take over the chest compressions to give you a moment to get a break. Remember, this is a team effort, and so you can only do so much by yourself. So you're going to be calling or activating EMS as soon as you can, and you're also going to utilize any bystanders who are in the area who can assist you. And guess what, team? I am so proud of you. You have completed a full 50-question CPR/BLS review and practice test If you are interested in becoming an instructor, if you want to learn more about the classes we offer at Florida Training Academy, go ahead and scan the QR code that's on the screen. And then if you want to support us further, don't forget that, yes, I'm an author. And so I have a new CNA exam prep study guide, which can be purchased directly on our website or on Amazon by scanning the QR code that you see there. Thank you for watching. It has been a pleasure helping you review and prepare for your basic life support class. And if there's anything we can do for you at Florida Training Academy, don't hesitate to reach out. We appreciate you. We wish you much success on your career endeavors. Have a great